way we practice medicine and administer medicine has evolved over the years, I want to focus this topic on remote medicine and telemedicine and what they call Internet of Medical Things. And when I first saw this acronym, I was like, what is this? And there's also something called Internet of Things, but acronym is called IOMT. You can Google this. It's called Internet of Medical Things. It basically involves various devices used to help administer medicine remotely or from a distance. Like, that's a big thing now. There's a big push for remote medicine. I think this is beneficial for people who live in far out rural areas who can't get to a doctor readily right away. But I think telemedicine, Internet of Medical Things, and remote medicine helps them to manage, and it helps to improve their health care and their well-being. There's remote devices that you can connect that can communicate to the doctor far away your vital signs, your heart rate, your blood pressure, or other things that are going on with you in real time over computer networks. I'm sure maybe if you've had surgery, they can check on your improvements. They can check on your progress. Maybe they can check on your lack of progress. I know that there's also what they call telemedicine, where they can diagnose you from a distance. I've experienced this myself. It was kind of, I want to say, I'd had a sickness before where I got sick and I was given medication. It was basically just a sore throat, but this one was like just really bad. It was really painful. Like, it was hard to swallow. I mean, just swallowing, regularly was just very painful. So I had it the year before, and I got it around the same time. And at the time when I got it again, COVID protocols had gone into swing, and I knew that this could be resolved with medication that I had the previous time I had the sickness. And I actually contacted the same doctor and I explained my situation. I said, hey, I got this sore throat. You gave me medication from around this same month a year ago. This thing came back. He gave me some antibiotics, and it cleared up in like maybe 2 days. So I knew that's what it was because I felt the same pain. The first time it happened, it was lasting too long. That's why I went to the doctor. Because sometimes you drink hot tea or drink something, hot lemon juice, they go away. But this case it just kept getting worse and worse, and it just lasted. It was very stubborn, and it was giving me a hard time. So that was when I went to the doctor the first time and got the throat gargle along with the medication. I mean, the first time it was really bad. I even had it got really pussy back there. Like, you could see that forming, and I was kind of like, oh, what the heck is this? It was like a really bad sore throat. And the second time it happened, it wasn't as bad, but I guess I panicked. I don't know, because I didn't want to go through that for like a whole, I don't know how long it was. It happened for it was too long, like 5 or 6 days, too long. I was like, okay, this is too long. I can't take it. It was just very painful. So I went and again, the COVID protocol was in play. So he gave me a call, and I explained to him what was going on with me. And he's like, oh, okay, no problem. I can prescribe the medicine and have you pick it up at the pharmacy. I didn't have to go see him. He didn't see me. He says he just looked at my paperwork and he saw that he prescribed it to me before. And all I had to do was pick it up at the pharmacy, which I did. And this was like an example of telemedicine. I spoke with him on the phone. He diagnosed me. And I was able to pick it up. And this time it went way faster. It took like a day. The medication worked really fast, even though I had to take like 9 pills of those antibiotics. And there was another case where I sprained something in the gym, and the doctor gave me a call. I had an appointment, but my appointment was over the phone. So he gave me a call, and I explained to him the scenario. I had sprained something and I pulled something in my back that the pull was affecting my back and into my groin area. It was like a slow. It didn't happen right away. I didn't feel it. So he basically kind of helped me to figure out what was happening, and they pulled me in for a scan. It's something where, okay, maybe I had the option of taking muscle relaxers. Getting tongue tied again. But I just opted to just let it kind of heal on its own. I just wanted to know what it was. And so he was able to diagnose that. And then when they had me come in for the scan, what is it called? Not the scan. Ultrasound. Yeah. So they told me what it was, like a pull, basically a muscle pull. So it wasn't that bad, but it was kind of aching. So I just said, okay, I'll let it heal on its own. I didn't want to take any muscle relaxers. I was ready to get back in the gym, but some things you can work on, some things you can't. But again, these things are good. They help save time. They help save resources. And they also help in situations like when you're in a pandemic. I think that maybe one day, maybe they'll be able to scan you remotely, right? Kind of like, hey, pull out your phone and put the camera on, and they scan what's wrong with you. They send the information back. I wouldn't be surprised if we're not too far from that. Some of the devices that are involved in what I mentioned before, Internet of Medical Things. Some of those devices, now they connect to your phone and they send back your your health information, as far as like your progress or what's happening, what signs is your body giving off, your temperature, like your blood sugar levels, those things like that. So this is all involved in this remote medical assessments, and I think we're gonna see more of this. And I still do think it's good I still like to go at least have the doctor take a look, but I don't mind when it's something that's not too serious. But who knows, maybe in the future, maybe even something serious will be looked at remotely. Maybe there'll be a special type of scanner on your phone. I know even with the dogs now can detect certain diseases if they sniff you. So who knows, maybe they'll send a dog out. I know some people are like, I don't know. But I think this is good for medical advancement. And I do think it saves time, and it saves also the patient maybe a trip, right? They may not be in the best health to make a trip, especially if they live in a rural location or a far out location. Or maybe the doctor's a specialist and the cities between the patient and the doctor are far. Maybe the specialist is not available in the town or the city that the patient resides. But let me know what you think. I know a lot of you have a lot of information out there in regards to this remote monitoring, Internet of Medical Things, telemedicine. Let me know your good experiences, bad experiences, and thank you so much for listening.